Good day. Today I am going to discuss about the Module 2, Dance Overture. According to the dance critic Walter Terry, no paints nor brushes, marbles nor chisels, pianos or violins are needed to make this art, for we are the stuff that dance is made of. It is born in our body, exists in our body, and dies in our body. Dance, then, is the most personal of all the arts. It springs from the very breath of life. Dance and the human body. Human anatomy is the branch of science concerned with the structure and function of the body. General anatomical terms, anatomical position. Descriptions in human anatomy are expressed in relation to anatomical position. Anatomical positions are referred to according to their orientation. Superior, toward the head. Inferior, toward the feet. Anterior, toward the front of the body. Posterior, toward the back of the body. Medial, toward the midline of the body. Lateral, away from the midline of the body. So what are the three main body cavities? First, the thoracic cavity. It is the space above the diaphragm. It encloses the heart and lungs within the rib cage, sternum or breastbone, and 12 thoracic vertebrae. Second, the abdominal cavity, which houses the abdominal viscera, begins below the diaphragm and ends at the top of the pelvis at about waist level. Third is the pelvic cavity, extend from the end of the abdominal cavity to the pelvic floor. Organ. It is a group of tissues that perform a particular function. For example is the heart, lungs, liver, and all of the organs. Pelvic floor. It is a group of muscles that reach from the pelvic bone back to the sacrum. One function of the pelvic floor is to support the internal organs. Tissue, a group or collection of similar cells and their intercircular substance that act together to perform a particular function. The primary tissues are epithelial, connective, skeletal, muscular, glandular, and nervous. Viscera, any internal organ. The systems of the body. Cardiovascular, composed of the heart, blood, and blood vessels. Digestive, composed of the oral cavity, pharynx, stomach, and intestines. Endocrine, involving glands and secrete hormones. Integumentary, composed of skin, hair, and nails. Muscular, composed of skeletal, smooth, and cardiac muscles. Nervous, composed of the brain, spinal cord, peripheral nerves, and sensory organs. Respiratory, composed of airways and lungs. Skeletal, composed of bones and cartilage. Common dance-related injuries. Bursitis. It is an acute, painful inflammation of the bursa, usually caused by repetitive friction from a tight muscle or a poorly executed movement. Hip bursitis occurs when the tendon of the iliotibial band rubs the greater trochanter of the femur or thigh bone. Joint sprain, a tear of the ligament classified from a grade 1 minor to a grade 3. Total tear, joint sprain, occurs when a ligament is overstretched or when a joint is bent in the wrong direction. A classic example is rolling over on the ankle. It is not uncommon for more than one ligament to be injured at a time. Muscle strain, a muscle tear that can range from a grade 1 or minor to a grade 3 or total tear. Muscle strain often occurs from quick movements requiring a sudden, hard muscle contraction, especially when a dancer is not completely warmed up. Shin splints, pain in the front of the lower leg. Their cause is unclear but they tend to develop after prolonged and or repetitive use of the legs in weight-bearing activities like running and jumping. Stress fractures, an incomplete break in the bone. In dance, they are often caused by repetitive landings from jumps. On an X-ray, they appear as a thin line through the bone. In order to heal a stress fracture, It is necessary to rest and reduce impact on the fractured bone, which usually means taking a break from dancing for a period of time. Shin splints are one result of stress fractures. The human body has different structural levels of organization. These levels start with atoms, molecules, and compounds, increasing in size and complexity to cells, tissues, organs, and finally systems. Dance and the human mind. Dancing is an excellent form of exercise because it not only burns calories and builds muscles, but it also contributes to an overall sense of happiness. Dancing also affects the mind by contributing to a sense of satisfaction. Dance or movement therapy or DMT. It is a type of therapy that uses movement to help individuals achieve emotional, cognitive, physical, and social integration. Beneficial for both physical and mental health. Dance therapy can be used for stress reduction, disease prevention, and mood management. In addition, DMT's physical component offers increased muscular strength, coordination, mobility, and decreased muscular tension. Dance or movement therapy can be used with all populations and with individuals, couples, families, or groups. In general, dance therapy promotes self-awareness, self-esteem, and a safe space for the expressions of feelings. Dance and the human nature. Current explanations for why humans dance tend to follow one of two approaches. The first, seen in psychological and some philosophical circles, begin with a human as an individual, person who chooses to dance or not for entertainment, exercise, artistic expression, or some other personal reason. Alternatively, a raft of sociological and anthropological explanations focus on community, asserting that dancing is one of the first means by which the earliest humans solidified strong social bonds irrespective of bloodline. Dance and culture. A culture's values are embodied, literally and figuratively, in its dance forms, and for most civilizations of the world, dance is one of the most important expressions of their worldview.